30 years ago in rural general practice, most people died at home. Few people survived very long after a heart attack. Children were born in their small local hospitals, and GPs were very much an active part of the local community. We were open all hours and mostly practiced reactive medicine. In those days we were particularly ineffective. Diabetics, for instance, often went blind and needed amputations. We seldom monitored blood pressure, and changing people's lifestyle like diet, drinking and smoking was a new concept. These days, we definitely practice preventative medicine a lot more effectively. Today, we look for signs of problems and systematically instigate lifestyle changes, actively reducing blood pressure, changing eating, drinking and smoking habits, and are much more aware of problems that could become critical. Today, people who die under the age of 65 from a heart attack are the exception rather than the rule. Cholesterol is measured, checked, and managed. Prevention is the order of the day. The modern-day GP is much more systematic, organized, and proactive. Consequently, many of our patients live to a ripe old age. The GP practice has changed over the years too. There are many more bodies around, not just GPs, but nurses and healthcare assistants too. Nurses are at the heart of our awareness campaigns, running respiratory clinics, diabetic clinics, healthy heart clinics, and even practice receptionists make a contribution to health and lifestyle. The GP practice is consequently a much safer and aware place, operating according to evidence-based guidelines. Computers carry a record of everything that the GP does. Appraisals are now undertaken annually, and revalidations are being introduced this year. Since the GP is better supported and informed, primary care is a far safer place than it used to be. Yet, despite coming through this long journey, we still haven't reached our final destination. There is still room for vast improvement. The NHS Alliance is on a mission, starting with Breaking Boundaries, our manifesto for primary care. Our goal is to break down the boundaries in the health system. Because of these barriers, our patients aren't cared for as well as they should be, and their health is not attended to as well as it could. It's time to liberate the primary care clinicians and correct the balance of representation within the health management structure that has for so long been dominated by secondary care. How did we get to this point? With the centralized NHS dominating the senior positions within the health department, attention is directed towards secondary care, leaving GPs, clinicians, opticians, pharmacists, and primary carers poorly understood, poorly recognized, poorly supported, and ultimately poorly resourced. Although the NHS Alliance grabbed the headlines for a while by highlighting the absence of primary care support within Whitehall, no real changes were won. Sadly, the status quo continues. The aim of the Breaking Boundaries manifesto is to breach the boundaries between the professionals and patients, allowing individuals to be more active in their own health and care. An environment where volunteers have a role and professionals act as advisors. The objective is to make the health service a true participant in building local health. Traditionally, the community, schools, supermarkets, local and agency services, and the health service have all operated within silos, and their boundaries have crippled their effectiveness. When these entities unite and act with a common vision, the whole partnership will finally make a real difference. The start of clinical commissioning in April and the publication of our manifesto signifies a landmark change and marks the breakdown of boundaries between primary and secondary care. Patients can be cared for closer to home and looked after within the primary care system, yet still feel properly supported. It's not about who works in which segment of the health service. It's about breaking down the walls of the hospitals, finally releasing clinical experts so that they can contribute to and help design local services. It's time for those working in primary and secondary care to speak openly and honestly, especially when things do go wrong. It's time for everyone in the NHS to understand that their first loyalty should be to the patient and not to their profession or organisation. It's time to listen to the front line. The Breaking Boundaries manifesto is a catalyst, a conduit from the primary carers. Now is the time to change the way we interact. It's time to listen to the clinicians, the people that work with patients every day. Read the Breaking Boundaries manifesto and listen to the messages from the front line, the stories, the comments, their thinking, and their experiences. Now is the time to listen to the people that deliver the care.